Here's a story about the dangers of e-cigarettes. Kaylin was the responsible one from her circle of girlfriends. Each year, they attended a desert music festival, a girls-only tradition. Kaylin did not drink, use marijuana, or ecstasy like the others, so she was the designated driver. After attending one event, Kaylin was driving them home while everybody else was asleep. She was the only one not high or drunk. Nevertheless, she nodded off while rounding a curve and their car flew off the road and hit a tree. Kaylin's head struck the driver's side door, causing traumatic brain injury. An ambulance was called and they were all taken to a local hospital. Kaylin remained comatose for 3 weeks. Kaylin suffered from chronic pain from the accident, so she was on medication for several years. Her doctor tried different painkillers, but Kaylin found it difficult to concentrate while on them. She was prescribed medical marijuana, which was less dissociating than the narcotics. Kaylin learned about vaping marijuana from her friends and decided to switch. It was cleaner and she liked some of the flavors. The vaping company advertised that mild heating produces less addicting nicotine than lighting and combusting a bud. Soon, Kaylin developed a persistent, non-productive cough. She also labored and irregular breathing. When it worsened, she went to the ER. A chest x-ray showed ground glass opacity, dense areas that do not obscure her pulmonary circulation. It was an abnormal finding that is not associated with air pollution or smoking, but is seen in lung cancer patients and those with COVID-19 infections. Kaylin was admitted to the ICU where she was intubated and ventilated. She was treated with antibiotics, bronchodilators, diuretics, glucocorticoids, and as a last resort, given extracorporeal membrane oxygen. This is a device that pumps blood outside of the body where it is oxygenated and then returned to her circulation. None of these approaches worked and she passed away. An autopsy was ordered. The pathologist obtained a bronchoalveolar lavage fluid sample and sent it to the lab. Using mass spectrometry, the sample was positive for vitamin E. A key scientific study showed that the acetate form metabolizes to a highly toxic substance. The pathologist noted her history of vaping, the absence of any other environmental exposure, and no medical history of asthma or other lung diseases. So he wrote, cause of death, EVALI. This stands for e-cigarette or vaping use associated lung injury. The legalities of THC vaping varies from state to state. The FDA has issued warnings about tobacco and THC associated vaping. This has led to a sharp decline of use among young adults, but sadly, not in time to save Kaylin. Stay tuned for more Lab Tale stories.